I've honestly found myself to be in a situation where I just feel destroyed. And it's not business as usual right now. Yeah, I feel it intensely.
Welcome to Rethinking Humanitarianism, a show that explores the future of aid in a world of rising crises. I'm your host, Tamam Al-Audat, CEO of the New Humanitarian. When it comes to humanitarian crises, not all people are equally vulnerable. Within the larger group of those facing a crisis, there are subgroups such as the LGBTQI+ that can be particularly vulnerable. And this isn't just a homogeneous group. Depending on the context, communities within this group can face further discrimination and neglect from the humanitarian sector. Given the recent hostile stance that Trump administration has taken on trans rights and the massive funding cuts targeting the LGBTQI+, what can the humanitarian sector do in the future to provide better aid to this community? To talk about this and more, I'm joined today by Dwyer, co-founder of the humanitarian development organization EdgeEffect, and I'm also joined by Jasmin, Lilian, Diab, director of the Institute for Migration Studies at the Lebanese American University. If you have any questions or comments, stick around for the credits to learn how to reach us here at Rethinking Humanitarianism. Emily, Jasmin, thank you very much for joining me today.
It's wonderful to be here.
It's a pleasure to be here.
Emily, you have co-founded EdgeEffect, which works with the LGBTQI+ civil society organizations and communities. You work with donors, with UN agencies, with INGOs and others. Tell me, why is it that LGBTQI+ community is particularly vulnerable when it comes to crisis situations and in humanitarian operations, as far as you could say?
So we set up EdgeEffect 9 years ago now or so. And it's because we recognized, as people who'd been working in the sort of international and some domestic aid sectors, that a lot of UN agencies, INGOs, donors, and other aid actors really weren't coming to terms with the existence of LGBTIQ people, far less what their needs are, what their strengths are, and how all of that could and should be addressed within the context of humanitarian crises. Because we hadn't seen ourselves and we hadn't seen our community within so much of the work of the humanitarian sector, we set up this organisation to try to, I guess, bridge gaps between LGBTIQ civil society organisations and all of those sort of mainstream humanitarian actors. And I guess why it's important, the easiest way to understand this is that LGBTIQ people, because of the marginalisation that many people live with before emergencies happen, go into emergencies in a situation where they end up having more profound needs or different needs that should be addressed in humanitarian crises. Then in the context of crises, sometimes new needs emerge because of people's experiences of trying to access aid and often finding it very difficult to access. And then you have a recovery phase, and then you have people who have needs in that phase as well and often struggle to get recovery support. It's not special treatment. It's just a matter of recognizing that LGBTIQ people have genuine needs.
Jasmin, I joined the New Humanitarian on the 1st of November last year in 2024. And on the 4th of November, your piece on the moral imperative to protect Lebanon's LGBTQI+ displaced came out. And that was one of the quite proud moments for me, because coming from Syria, this is a topic that isn't talked about in the Middle East, at least not this openly. You writing about it addressing people who are in a particular vulnerability and insisting that they wouldn't be forgotten in the middle of mass displacement was a really important choice. Tell me what got you there. Where does this piece of work come from?
What we do at our Institute for Migration Studies at the Lebanese American University in Beirut is we work across the migration, displacement, refugee spectrum. And what we try to do very specifically in Lebanon, in the region, we homogenize groups of displaced people, refugees, IDPs in Lebanon's last 2 year armed conflict. It's always a conversation around the Syrian refugees, the Lebanese IDPs, the Palestinian refugees. We don't unpack them against anything intersectional. The humanitarian space has a very blind eye to these different intersectional approaches and these categorizations as well. So what brings us to this research is really wanting to focus on the marginalized of the marginalized. We were having a mass internal displacement crisis in the country. Lebanese people were internally displaced, Syrians and Palestinians all alongside each other. And the humanitarian space was so strained and overwhelmed in their own words, based on our research and speaking to them, that they needed to be selective and they needed to prioritize what they describe as urgent need versus other needs. Always against this backdrop, of course, mental health, gender, any questions that complicate, kind of this built-in structure that the humanitarian space functions in. Anything that challenges that really is on the back burner, unfortunately, when there's a crisis. The queer community is particularly important to us and to our research because, as you said, the conversation is not being had. And if it is being had, it is being had in a very siloed manner as well. And because our humanitarian space and our research space, by the way, is built and structured around these categories, and, dare I say, these categories of convenience, any intersectionality in any approach is a footnote. So we wanted to make a point of it that a straight cisgendered male Syrian refugee was not having the same experience as a trans Syrian refugee woman. We wanted to complicate this. We wanted to unpack this. In the last 2 years, when we had over 1 million people displaced because of the armed conflict, shelters were turning queer people away because they didn't fit a binary. Trans participants in our studies explain how they needed to divulge their gender identity or ascertain who they were in order to get access to certain spaces. And the situation gets more and more dire and more complex the more you unpack it. Noting as well that, the LGBTQIA plus community is also a very diverse community in itself. So we try to do justice as much as we can in our work to people and their identities and their lived experiences.
In following about not homogenizing, I would like us to try to dehomogenize LGBTQI plus people and their experiences in a humanitarian situation. Emily, could you talk about these differences and the particular vulnerabilities and examples that one would need to open our eyes to and try to understand in a given situation?
Absolutely. And I think it's a great question because it's really easy to say LGBTIQ and assume that sort of everyone within that acronym is having sort of roughly the same kinds of experience, or that all people who identify as queer or use other terms like diversity of Sogiesc, that there's all sort of roughly the same. And while there are certain similarities of experience and a sense of community amongst people of diverse genders and sexualities and bodies, there are specific kinds of experiences. And so in certain contexts, lesbian and bisexual cisgender women might face particular disadvantage, partly because of patriarchy and challenges that they experience as women, and partly because of their sexuality. As a trans woman, I'm often talking with trans people in humanitarian crises, and some of their experiences are different and profound. And that's sometimes because trans people are inherently more visible. So when you're making a decision about, am I going to go and line up and access this aid? Am I going to go into a shelter? Are my needs as a trans person accessing healthcare going to be understood or met? If I'm a trans man and I'm menstruating, am I going to be able to get a dignity kit that reflects my experience and reality of the world? There are so many ways in which being trans means that you have a different experience of the world that the humanitarian system is sort of yet to sort of catch up with and deal. In the Indian Ocean tsunami, there was research done about the experiences of the Aravani community, so a gender diverse group of people, and their challenges accessing aid because they didn't fit into the gender binary and couldn't tick the box for M, couldn't tick the box for F, and so missed out on access to all kinds of aid. But one of the things that was also missed is that the way that the Aravani community was doing dances, was taking part in cultural events. And so in order to do that, they needed to have dresses, they needed to have jewelry and makeup. And these were some of the things that they lost in the tsunami. But try going to a humanitarian organisation and saying, well, as part of the recovery programs, we need to be buying dresses and makeup and jewelry. And they didn't get a positive response to that. And so that was, I guess, sort of part of not understanding the nature of trans people's lives.
Thank you very much, Emily. And I'll add to that, coming from a medical background, we end up going to a very basic set of treatments, and those do not include supportive or hormone replacement or issues like that that are needed to continue and aren't necessarily considered. So the knowledge of those needs is imperative. Let me move to Jasmin. And in your article, you talk about a difference in perception and acceptance in Beirut, for example, vis-a-vis rural areas in the south, for example, where many of the refugees came from. You talk also about compounded vulnerability, where a Lebanese queer person would find a Syrian queer person doubly vulnerabilized, if that's a word, by their circumstances. I will take your point about dehomogenizing, because we struggle in the humanitarian sector and in general with homogenization. If you get someone going on what is called a humanitarian mission to an Arab country and you ask them, I mean, they are likely to have heard a sort of singular narrative that they throw people off the roofs if they are gay. It's not allowed. And at least it requires multiple layers of nuance. I mean, particularly when it comes to Lebanon. I think the first Arabic novel that included an openly gay man was written by Huda Barakat in the early 90s. There are multiple authors who wrote really good literature on it. There's the first openly gay frontman of a band in Masroor Leila. There is a culture that exists there that is indigenous to Lebanon, to the Arabic language, and so on. But this homogenization of people, is it a problem in itself if we assume that it's completely unallowable, it's completely non-existent, people will never come forward? As a humanitarian sector, are we helping absent queer people by assuming things about the cultures they exist in?
I really welcome your question very much. And let me then answer your question preliminarily with a question. Why do queer displaced groups across the country speak to us, but don't speak to the humanitarian space? And there's two fundamental reasons as to why this happens. First of all, we seek them out, want to speak to them, and want to listen to them. The humanitarian space does not do that. But also, we foster a relationship of trust and a safe space whereby what they share, what they express, what they discuss about their very personal and very, very challenging experiences, particularly when you add a layer of displacement, again, to queerness in the region, we assure them that that information is not only protected, but their identities are protected, and that an academic study, give or take, is at least much less threatening than divulging information to a humanitarian actor if it's not done in a safe way. When we speak to people about their experience with displacement, at least across the last 2 years, and we tell them, okay, but there are UN agencies and humanitarian actors in your regions, in the south, where, the major wave of displacement was happening, but also across different parts of the country. Tell us what your experience is with them. Why don't you speak to them? Why don't you reach out to them? And the responses are very pragmatic, and they are very much linked to this notion of safety. So I will have a queer Syrian participant in one of my studies. This person, let's say, lives in a part of South Lebanon. Mass displacement is happening around him. And he tells me, if I want to go up to a staff member from a UN agency or a humanitarian organization, that person knows my brother, that person knows my neighbor, that person knows my parents. I can't be absolutely sure that if I divulge information to that person, that that information is going to remain safe, that my identity is going to remain safe. And that's a very valid concern that we've voiced in multiple spaces where we've had the opportunity to present our research, particularly to UN agencies and larger humanitarian actors. And there is a way to overcome this level of insecurity when it comes to participants moving forward. But there isn't an intention to do that. There isn't an intention to establish safe spaces, to prioritize these types of conversations with certain groups. There is a crisis response that's very blanket and a crisis response that wants to make a large impact in a quick amount of time. And I recognize this, but these are the people that fall through the cracks. To your question around queerness and the region, let's not also adopt this kind of blanket understanding or a unified understanding of what that means. Lebanon is quite queer friendly compared to other countries in the region, absolutely. It has a very vibrant civil society space that caters to the queer community, works with the queer community, is from within the community. I, as a researcher in the space, am able to write about what I please. I'm able to publish what I please, speak to who I please. It is not a space where we feel restricted in that way. Having said that, homophobia exists absolutely everywhere. And in our region, because of the patriarchal society we live in, it's very, very sensitive and very much linked to kind of these existential principles too. So you will find spaces in Lebanon that are absolutely unsafe, the way you will find spaces in the United States that are absolutely unsafe, or in parts of Europe that are absolutely unsafe. But what I will say, and I agree with you absolutely, is that the community is very present and vibrant and very much part of the local culture, artistically, socially, absolutely everything in between. So this conversation around the queer community inherently not being part of our social fabric in the MENA region is a very void argument. It absolutely is.
Coming to, again, the humanitarian system itself, one of the eye-opening experiences in my career was in talking to a woman who is an African Black Muslim woman in a hijab. And she told me when she was leaving the organization, I was asking her why. She said the quintessential humanitarian is still a white middle-aged man who smokes and drinks alcohol and who's an atheist. And I thought to my, and she said, I'm not any of those. And I thought, hell, I'm 5 of the 6 and I still feel excluded. It's, I can't even start to understand her experience.
Yeah.
And that particularly, it's been nearly 6 or 7 years ago since she told me this. And this sentence never leaves my mind because it puts me in context of people who are probably much more excluded than I am. In the humanitarian system, and among us who work in this system, there are plenty of people who belong to the LGBTQI plus community, and it is becoming more visible and more talked about. But Emily, I do want to ask you about your perspective about this.
So I underwent transition about 12 years ago now. And at that point, I needed to find a new job. And I remember talking with some humanitarian organizations, I think one in Sudan, one somewhere else, and getting to a point where I had to say to them, look, I'm about to come out, I'm about to transition as a trans woman. How do you think that's going to work? What are your thoughts about that? And the responses that I got were like, oh, we haven't ever really had to think about that. I'm not sure. It was clear that as a sector, we were entirely unprepared to deal with the realities of a more diverse workforce and to put in place systems that supported a diverse range of people to work in the humanitarian sector. I think my experience then, and one that has been relayed to us many times since, is that the risk that comes with being an LGBTIQ person is often individualized and put back onto individual LGBTIQA workers as something that they need to deal with. So this is a risk that you're taking, or you need to go back into the closet if you're going to go to this place, or you won't be allowed to go to that place. It's on you. All kinds of ways in which humanitarian organizations don't take responsibility for sharing the risk and for coming up with organizational and systemic ways of supporting their own diverse workforce. There has been research done with LGBTIQ people who work inside of aid organisations, asking them, do they feel comfortable being out within aid organisations? And a large group of LGBTIQ people said, well, no, we're not. We don't believe it's safe for us. We feel that there's going to be discrimination. We feel like we might not get postings to places that we want to go, that our careers will be truncated because we're LGBTIQ people, and because we know that our organisations don't really have the systems in place to accommodate and work with diversity. And so people stay in the closet and don't speak up. So there's a lot of work that aid organisations need to do to really be diverse workplaces. And we know that that language, diversity, equity, inclusion, is something that a lot of organisations have shied away from because the threats of reduced funding. And I struggle to know what to say to those organisations, because I know if you're not going to follow basic human rights principles in terms of the way that you engage with your own workforce, then what business do you have doing humanitarian work at all?
We have started actually reporting on some of those organizations that started sanitizing their websites after the budget cuts. And I would say for shame, because the fact that all this wave of talking about inclusion and about then disappears the moment you get a threat of funding cuts. Where do principles end and opportunism begin is very difficult to come to terms with at this point.
Yeah, I think it's a really important point about humanitarian organisations being willing to walk the talk and to stand up for these ideas within their own organisations. I mean, there are times where I think humanitarian organisations try to address LGBTIQ inclusion as a programming issue without having gone through a deeper process as organisations of understanding, the assumptions that they're making about their own internal ways of working. And when they haven't gone through that process, that's where we're more likely to get tokenism. We're more likely to get work that's unsafe. We're more likely to get organisations, pulling back from doing LGBTIQ work in places where it is possible to do at least some things. It's really important for humanitarian organisations to do that work internally, partly because you should be doing it, and partly because it makes you a more effective organisation. One other thing that needs to be recognised is that aid organisations really often do rely upon LGBTIQ people to be individual champions, to be raising these issues, to be doing this work outside of their regular hours, outside of their responsibilities, outside of what they're already paid to do. And honestly, it's exhausting. It's often emotionally very taxing for people. And I can just speak personally that after doing this for 9 years, I'm exhausted in ways that are just so deep and that have been made worse by all of the aid and funding and program cuts of the last 6 months. And I've honestly found myself to be in a situation where I just feel destroyed. And it's not business as usual right now. Yeah, I feel it intensely.
Jasmin, you've met people individually, you've talked to them. For you, what was utterly unimaginable and you had to face in that? What still shocks you?
Very little shocks me, to answer your question, Tamam. I think it's been an incredibly challenging, at least 2 years, to frame that a little bit temporally, against the backdrop of the study you're discussing, when it comes to what has been surfacing in the areas of people's experiences. The queer community, particularly Syrian refugees, Palestinian refugees, and Lebanese IDPs, have consistently described their experiences across the last 2 years as some of the most challenging forms of access to humanitarian aid, challenging circumstances when it comes to the provision of shelter, even conversations around return, And we've heard some very painful stories when it comes to that. What does shock me on a more positive note, what still shocks me when I speak to people is their adaptability and their, for lack of better term, resilience in the space. So when I hear a story around how people maneuver this landmine of a humanitarian space in many cases and of, public institutions in Lebanon and kind of forge their own ways, those are the pleasantly shocking stories that we find. We interview different groups that have grassroots organizations that are doing peer-to-peer support, smaller NGOs in the country that really have some of the most creative forms of reaching out to the community and accessing them. Around the Beirut port explosion, we wrote a piece about how organizations that focus on the queer community actually transcended this siloed humanitarian model. So you would find that an organization that caters to the queer community was supporting the Lebanese IDPs, now IDPs from the queer community, Syrian refugees, and Palestinians without looking at nationality or the silos of what humanitarian organization is responsible for who. So in a time where UNHCR was turning away people that weren't Syrian and UNRWA was turning away people that weren't Palestinians and local organizations were turning away refugees, telling them they catered to the Lebanese displaced community, queer organizations were able to bridge that gap and provide a very disaster-focused model. So I think that's what shocks me pleasantly, at least. Am I shocked about the gaps in the humanitarian system across the last 2 years? Very little shocks me. Very little shocks me.
Emily, you mentioned that humanitarian organizations couldn't wrap their heads around LGBTQI needs. Why do you think that's the case?
In most cases, no one's saying that this is deliberate. I think one thing that we do see, and something that we put at the center of our work with humanitarian organizations, is the idea that in our work, we make all kinds of assumptions about who people are. So we make assumptions that people are heterosexual. We make assumptions that people are cisgender. We make assumptions that people fit into the gender binary. We make assumptions that people fit into a binary of sex characteristics. And if you make those assumptions, and if you're not critical about those assumptions, then you can just barrel along doing what you're doing and not see LGBTIQ people and not see that the way that programs need to be designed, implemented, evaluated needs to change as a result of that. So I think it's partly assumptions that we make about the world and that are still sort of deeply embedded within a lot of the way that we think. I think a substantial part of it is a lack of funding for gender and inclusion work within the humanitarian sector. That was the case before all of the funding cuts that we've seen. And I remember having conversations with donors and other folk, people who would say, look, we know that we should be doing more, but we don't have enough money for the other parts of gender inclusion that we're already doing. And so how are we going to fit LGBTIQ people in? And at some point, some people are going to miss out, and unfortunately, it's you. So I think partly it's funding. I think partly it's also missing conversations between humanitarian organisations and civil society. This is not restricted to LGBTIQ parts of civil society. We know that in all kinds of different humanitarian contexts that national civil society organisations often feel like they're not part of coordination mechanisms, that they're not equal partners within the way that projects are designed and implemented within their own societies. There's a missing conversation there, which is made worse perhaps in the case of LGBTIQ organisations because of the uncertainties about engaging with LGBTIQ organisations, fears that LGBTIQ organisations are very activist, that it will get humanitarian actors in trouble with national governments and other partners that they value. And just because maybe a lot of humanitarian organisations are just unfamiliar with working with LGBTIQ organisations or people at all.
Jasmin, in your research, in your writing about this, how did you find that the LGBTQI plus community has been able to navigate those challenges? I mean, we need to also learn to facilitate those means and resilience they have, and rather than obstruct it. How do people deal with it? And where are the gaps that humanitarians can potentially, with enough understanding and humility, be able to help bridge?
I mean, let's begin maybe with what the humanitarian space is doing right. In Lebanon, we currently have an LGBT task force comprised of humanitarian organizations that work directly with the community, smaller organizations, UN agencies, and larger actors as well. So essentially, mostly every humanitarian organization or actor that works with the community or caters to them. The problem with setting up a task force like this and not moving it to the next stage where they are actually part of the decision making process. They are actually part of the changes, of the implementation of different lines of programming, of soliciting funding for certain programmatic priorities as well. The issue is that this turns into quite a bit of tokenism. And this is kind of the experience that the queer community expresses. The humanitarian space definitely acknowledges the plight or the intersectional specific challenges of the queer community, whether we speak to UN agencies that work with displaced individuals, with refugees, with migrants. Everyone is well aware when we talk to them about intersectionality, but it's all about prioritization. And because the humanitarian space does not prioritize gender in its programming largely, especially now with funding cuts, humanitarian actors tell us that the first two things to go are the gender programs and the mental health support programs, right? You know, kind of the less important things in the eyes of actors that are maybe prioritizing people's physical protection, et cetera, et cetera. And so smaller humanitarian organizations and queer focused organizations in the country are very well aware of this. They know there's a task force and that they will be listened to, but it's not so much whether or not you're listening in a shallow sense, it's where this messaging goes, right? If you're listening properly. Smaller organizations have worked very closely with each other in very closed networks, are very innovative in their approaches on how to reach different members of the community, very critical when they enter areas that are perceivably more hostile to the community or more conservative. They have their shelters, their safe spaces, their hotlines, their secure social media groups. They make a genuine effort to reach out to the community through snowballing in a very safe and secure way as well. And they delicately, I think, balance very well disseminating information about the availability of queer friendly services across the country for different displaced groups without also jeopardizing these locations and people's safety and it not becoming information in the hands of the wrong people. In Lebanon, we selectively criminalize whatever is convenient at the moment in order to divert from larger issues and larger challenges. And so the queer community is in many moments criminalized, in many moments focused on, as is the refugee community, as are different groups. And when these groups overlap, that's when, you know, the conversation needs to happen.
If you work in a humanitarian organization, I mean, we have a long-standing dogma of you're not political, your job is to save lives, as many lives as possible. People might be homophobic, haven't thought about this, anything. And that explains to me at least some of the fear of disclosing people's status to a humanitarian organization. They cannot guarantee that whoever they talk to would be empathetic or capable of help. Emily, what did the humanitarian system, both as a system and as individual organizations and people, done well in the past period? And where did it fall short?
Yes, in the context of Lebanon that we've been talking about, yes, there are LGBTIQ organisations there that have done extraordinary amounts of humanitarian work, that have often done that work on behalf of humanitarian organisations and have taken that work on willingly, but then have almost been left burned by it. It's like, well, we can do this, but it isn't actually our core function to be doing this. The humanitarian sector should be carrying more of this weight. But it's not, and you're relying upon us to do this and to be this bridge to the LGBTIQ, queer, diverse community. And that puts incredible stress on those LGBTIQ organisations, especially when the funding stops or programs stop, and then community members sort of start questioning the LGBTIQ sector about, well, why has aid stopped? And because LGBTIQ organisations have been used as these intermediaries, they then face often the questioning of their own communities when they're not the organisations that have the power in the humanitarian system at all. When LGBTIQ people talk about crises and LGBTIQ organisations talk about crises, we're talking about crises that occur in all aspects of our lives, whether or not there has been a tsunami or a bombing or a displacement happening at the same time. It's a much more feminist way of working, if you like. And in terms of what the humanitarian community sort of narrowly conceived have done well, often there are individuals within those organisations that are doing extraordinary things to keep a conversation about LGBTIQ inclusion alive. And so there are organisations, IOM, UNHCR, just to name a few that we've worked with, that have those people, often LGBTIQ people, sometimes allies, that are just keeping that conversation alive. I think we did start to see some donors putting money into LGBTIQ inclusion, and the US government was one of those. USAID was funding LGBTIQ humanitarian work. PRM was funding LGBTIQ work within the context of refugees and displacement. There were some donor organisations that were putting money into this space. And so, just to pick one example, before the US government funding cuts, we were working with Save the Children on a project to develop guidelines and support to address child protection issues for LGBTIQ people in humanitarian crises. There were projects emerging in which there was an understanding that the humanitarian system has to do more, that it has to go beyond bland statements about including LGBTIQ people and actually start engaging with what does good policy look like? What does good practice look like? Those have been exceptions rather than the rule for all of the reasons that we've been talking about, because of the assumptions we make, because of the lack of funding, because of the lack of nuance in the humanitarian system and its lack of sort of capacity and sometimes interest to deal with diversity, the way that do no harm gets sort of translated into, well, we better do nothing, even in contexts where some things are possible.
As an ignorant outsider, one of the issues that I see as affecting our understanding of an ability to function, you mentioned feminism, and there's a whole rift within feminism, for example, on the issue of transgender. There are outspoken so-called feminists who are quite aggressively anti-trans. And in my experience, for example, issues relating to gender equality have been brought up in a humanitarian organization to talk about equality in leadership rather than equality in delivery of aid in a community that is being served. It has been brought as, let's do gender equality and then we can talk about queer issues. So there has been muddled conversations.
When I'm talking about feminist ways of working, by that we mean understanding power relationships, understanding positionalities, working in a way that understands and disrupts those power relationships. On the question of the sort of anti-trans, anti-rights, anti-gender movement, I mean, yes, this is making things harder for LGBTIQ inclusion globally in the development sector and in the humanitarian sector, in all of the sectors. And that's something that we all need to push back against, because as we know, it might be that LGBTIQ people are the first to be picked off, but eventually they'll come for all of us. So we really are in this together. A third way into what you were talking about there is about the way that there are all kinds of delaying strategies that are used by the humanitarian and development sectors. And Ilaria Michaelis has written some great articles about this. Well, we need to do more research, or we need to do more training, or we need to work on these other issues first, and we haven't finished working on gender equality conventionally understood as women and girls, and we haven't finished this, and we're busy doing something else. So there are all of these reasons that are just trotted out with great familiarity for LGBTIQ activists about why things can't happen yet. If there was one thing that I was going to suggest to start making progress, I would say that, especially in countries where there are LGBTIQ organisations that are registered and that are working, humanitarian organisations can start building relationships and partnerships with those LGBTIQ organisations and start to get to know the LGBTIQ community, preferably pre-crisis, preferably before everyone's running around, but can build those relationships, can start to understand the community, can start to understand all of the community-based response that's happening in the gaps, And if we get better at doing LGBTIQ inclusive, I guess, in some of these more permissive environments, then we can take that learning and we can move it into places that are maybe sometimes more difficult. And by saying this, I don't mean to sort of say, well, let's neglect LGBTIQ people in Yemen or some of the more overtly more difficult places. But given that the humanitarian system is capacity constrained, is funding constrained, is risk averse in so many ways, I kind of feel like a good starting point is at least to do LGBTIQ inclusion in the places where it's easier and where it really should be being done.
To the humanitarian policymaker, to an organization, or to a country practitioner who is trying to do their best, if you tell them, start by doing this, what is your call to action now for the humanitarian sector?
The biggest messaging, even when we have these types of conversations, is around listening with intent, right? Intentionally bring groups together of people that you know little about, that you do not understand, and listen to them with intention. Do not hold these spaces to tokenize the community, to tick them off a bucket list, because a lot of our research centers around bringing forth things that are already working for the community that larger humanitarian actors can build on. And what's fascinating about all of this is that the best practices that smaller organizations bring forth in these big, high profile meetings with organizations that have millions and millions in funding is that they do it with little to no resources at all. So I think step one would be bring these people together, ask them how they've been navigating these spaces, and see what you can take away from that. Because we're not asking humanitarian actors to dip into a space that is not explored or a space that they need to develop on their own, right? There are so many actors already doing this. There are refugee-led organizations, there are queer-focused organizations, there are organizations working at the intersection of both that can really provide, I would say, tangible and applicable input in spaces that otherwise, larger humanitarian actors don't prioritize. I think, yeah, listen with intent. Absolutely.
I will add a caveat here. In the humanitarian sector, we have a tradition of listening and not acting upon what we listen to. So listen with intent and act upon it. We've always observed this. We sit and consult with people and then we do whatever we want. So I'm just saying we need to listen with intent, absolutely, but we also need to follow what people tell us.
Often something is possible, maybe not everything, but often something is possible in a humanitarian context in terms of doing LGBTIQ inclusion. Engaging with LGBTIQ formal or less formal organizations is almost always the right place to start. And it might be that you can't do things yourself, maybe as an organization in your mainstream or targeted programming, but it might be that you can do things with or through an LGBTIQ organization. Of course, you need to resource them if you're going to be asking them or supporting them to be doing that work. So that's the first thing. The second thing is to lift our heads beyond the protection space. We often see LGBTIQ people or engagement with LGBTIQ people only through a protection lens. And that is often where this work starts, and that's really important. But if you're someone who's working in shelter or WASH or education or child protection or any of the cluster areas or a range of thematic areas, there's work that can be done in these areas to think about how your mainstream programs can be a little bit safer or a little bit more inclusive, or how you might be able to develop a targeted program in those areas. And we really need to build more of the sort of the policy and practice in those thematic and cluster areas. The third thing would be that we know that the humanitarian system is in crisis. We know that we need different ways of working. We know that we have to grapple with politics and power in ways that the humanitarian system has tried to distance itself from. But for all of the reasons of Gaza and elsewhere, we know that it's untenable for us to pretend that we're just living in some kind of naive post-World War II environment. It might be that the humanitarian system needs to change in more fundamental ways and learn from the ways that LGBTIQ organisations are already working in the kinds of places that we're talking about.
Jasmin, Emily, thank you for joining us today and much appreciation for your work.
Thank you.
Thank you for taking an interest and for the solidarity. It's definitely appreciated.
Thank you for listening to Rethinking Humanitarianism. Our show is produced, edited, and mixed by Levi Sharp. Editorial oversight provided by Erwin Loy, Eric Reddy, and Freddie Buswell. If you have any questions or comments, you can email us at podcast@thenewhumanitarian.org. Please rate and subscribe to our show wherever you get your podcasts. Also, consider becoming a member of the New Humanitarian to help us continue reporting from the heart of crises. Go to www.thenewhumanitarian.org to find out more.